Hello dudes, once again welcome to my OET channel. Today we will see another one referral letter. This letter actually is directed to the nursing director in a community service area. Here I am introducing one patient who has undergone one surgery 1 month ago. That is the bilateral lung transplantation. During hospitalization, he developed some pressure sore. This patient actually after discharge going back to home, but he requires some continued care until his complete recovery. The writing task is you are going to write a formal letter or a transfer or referral letter to a community health center requesting continued care for this patient. So let us see the writing task. You are a registered nurse at a rehabilitation ward. Using the information and write referral letter to the nursing director, Maureen Martinson's Spirit Community Service, 18 Tambourine Drive, Mount Tambourine, QLD 4273, requesting ongoing for this patient. So we will start from the writing content. So always start from the writing task so that you will come to know what is the type of letter, whether it is known case or unknown case. So in this case, we can see that this is unknown case and it is a referral letter, and we are going to write the letter to the nursing director. Then you can see the content of the letter. Today's date is 28 to 2018. Patient details. Name is Kenneth Phillips. Date of birth 5 May 1972. Patient lives alone. So wherever I have marked, then you have to mark it in your question paper because these are the relevant data. This relevant data we should not avoid in our letter. And always keep it in mind that to whom we are writing. So here we are writing to the nursing director. So everything we have to include. And he is a builder for 23 years. He was a builder for 23 years on business. Has son in UK. Divorced 15 years ago. No support from ex-wife and son. Medical history: interstitial lung disease since 2011. Patient admitted in Spirit Hospital for bilateral lung transplant on 10 January 2018. So we will start our story from here. Patient stayed ICU post-operation and transferred to thoracic ward on 20 January 2018. So for 10 days he was managed in ICU, then transferred to rehabilitation ward on 15 February 2018. So more or less 25 days patient stayed in thoracic ward. Then he was shifted to the rehabilitation ward. Post-operative condition: patient is using nasal prong 2 liter oxygen and the saturation is maintained 99%. Here we have many contents. They have given like summary of hospitalization. So for us, no need to take everything. So here in this post-operation condition, we can see that gradually patient improving, and at the end of the day, at the day of discharge, patient is out of oxygen. I mean, patient can tolerate in room air, and he is maintaining 94% of saturation. So no need to mention everything. What all the things is given in the case note. We have to abstract the relevant data. That means what is the thing happened gradually and what is the condition at the time of discharge. That is only the thing is needed, and what I mentioned here is like underlined in reading. You can see that is all the thing we are going to write with the connectives. So patient is at that time patient was on nasal prong and the oxygen therapy was there continuously, and that day patient is able to walk 20 meter with a 4-wheel walker. Only requires supervision, requires minimal assistance with the hygiene, assisted washing and drying back and feet. So at that time patient was in need of assistance for daily living activities. Only requires adjustment for upper and lower dressings, continent, bowel open regularly, low listeria diet and thin fluids, good appetite. But during hospitalization, he was complicated with a stage 2 pressure ulcer in coccyx. So there was daily dressing was there at that time. Patient compliance pain using pressure relief mattress and cushion. So at that time, this pressure ulcer is managing now. Even now, patient has pressure ulcer. It is managing well with the daily dressing and pressure relief mattress along with the cushion. Along with that, they have started some antibiotics and some other medications like azithromycin 250 milligram 3 times per week, then voriconazole 250 mg BID. Like that, so many medications are there. So here actually we no need to write every medication because there is 1 2 3 4 5 6 7 8 9. There are 9 medications, so we could not write every medications in our case letter irrelevantly, and these medications are not in priority because already it got it's in the last. You can see that it's mentioned that patient can self-medicate and no need for administration by the community health nurse. So just she want to see the compliance on medication administration, just monitoring. Patient will administer himself. So here no need to write everything what the medication has given. Just we can write it's like antibiotic, analgesics, or antacids, or vitamin supplements, something like that. That's why I have marked only 3 medications. Then we can see the social history. Patient lives alone and on unit. Good support from younger sister who lives same area. So other than his younger sister, nobody is there to take care. That's why a continued care is essential from community health center. Patient request to go back driving and on business. Recent nursing notes we can see from here. This is from the rehabilitation ward. That's from 17th February 2018. Patient was quite anxious and compliant SOB during mobility and continuous oxygen therapy. So even in the rehabilitation center, they continued the oxygen therapy. Patient is reluctant to reduce oxygen, compliant, coccyx pain, regular Panadol given, good effect, dressing change. So during this rehabilitative time, patient was managed with a daily dressing and analgesics, minimal assistance for hygiene and daily living activities. And gradually we can see that patient has used a single point stick. Patient accepted to reduce oxygen to nasal prong 1 liter this morning, and oxygen saturation is maintaining 97%. Patient was able to walk with single point stick around 20 meter without SOB. Only required supervision for mobility. Patient was very happy with the progress and keen to be independent. So gradually we can see that patient is maintaining oxygen and they reduced the oxygen, but completely they didn't stop. And regarding the mobility, it is increasing. So the patient is happy that it's nearing to discharge. And the next day, medical officer discussed with the patient about home oxygen, but patient agreed to go home without oxygen. Patient come and self-medicating with the supervision. So these things we have to keep it in your mind. Patient can take medication without any assistance. And 28 to 2018, patient is happy to not use oxygen since last night. Oxygen saturation is maintaining in 94%. Patient was independent. So in this point, this is the conclusion for the present medical paragraph. At presently, at the time of discharge, when we are writing letter, what is patient's current situation? So that's the thing what we are going to write. Patient was independent with the hygiene and daily living activities, mobilizing nil aids with the supervision. Patient self-medicating well with supervision. Wound nurse came and reviewed coccyx wound, and she told that it is required dressing every second day after discharge. Aim for discharge on 1 March 2018. So there is a recommendation here, dressing every second day after the discharge. So sometimes the recommendations will be here and there, so you have to find out that point. And again, once again, we will read the writing task. You are the registered nurse at the rehabilitation ward. Using the information and write a referral letter to the nursing director requesting ongoing for this patient. So I hope it is clear for you. That is nothing but we are writing a referral letter requesting community nursing service for the continued care for this post-operative patient. So let us see how we will write the letter as an OET format. We will start with the date and address. 28 February 2018. Mrs. Maureen Mattinson, Nursing Director, Spirit Community Service, 18 Tambourine Drive, Mount Tambourine, QLD 4273. Nothing but we will just copy and paste the address which is given in the writing task. Salutation, dear nurse. Here, this is a nursing director. So, here we can write the patient's surname. Mrs. Martinson, and date of birth is so here the salutation is dear Mrs. Martinson regarding Mr. Kenneth Phillips, and date of birth is 5 May 1972. Next, we will move to the purpose paragraph or introduction paragraph. So here we have to keep mainly two things, that is a recent present medical condition and the requirement. The third one is optional, that is the discharge status. So in this case, we can see that the recent present medical condition, we have two things, that is patient is recovering from bilateral lung transplant surgery, and the second one, presently patient has stage 2 pressure ulcer in the coccyx. So these two things have to be written because both are important. Patient is recovering from the surgery. So regarding that we have many points, and regarding the present problem, that is patient have pressure ulcer. So for both we have to give importance, and we have to write in the present medical paragraph as in equal importance. So we can write like this: I am writing to refer Mr. Kenneth Phillips. So here you have to write patient's full name, who is recovering from bilateral lung transplant surgery and has a stage 2 pressure ulcer in the coccyx. He requires, this is a requirement for our introduction paragraph, that is a continued care. He requires continued care and is said to be discharged on 1 March 2018. So here the discharge date is given clearly, so we can write like that, and the requirement is continued care. So once again I will read for you. I am writing to refer Mr. Kenneth Phillips, who is recovering from bilateral lung transplant surgery and has a stage 2 pressure ulcer in the coccyx. He requires continued care and is said to be discharged on 1 March 2018. Next, we will move to the present medical history paragraph. So here, in this case, we have to give equal importance for the surgery and the pressure ulcer. So we can write it like a two paragraph. The first paragraph contains Miss Lawton was admitted. So we will start from the beginning. Every letter should have a story in this medical paragraph. So we will start from the surgery. So we can write like this. Mr. Phillips underwent surgery on 10 January 2018 and was managed in the intensive care unit. So here actually no need to write he came and he admitted and he scheduled for surgery, no need. And even the surgery name is not needed because we have already written in the introduction paragraph. So just we can write that he underwent the surgery on this date and was managed firstly in the intensive care unit. Then we can write thereafter, comma, he was shifted to the thoracic ward. He was commenced on oxygen therapy and treated conservatively. So simply we can write that he was commenced on oxygen therapy, and there they didn't mention anything detailedly what all the medications, what all the things it has given. So just we can write it like a simple way. During hospitalization, comma, he has developed a pressure ulcer, however, which is managing well with daily dressing, pressure relief mattress and a cushion. So here actually after the surgery, the main things we have written that patient have underwent the surgery and there was oxygen therapy and other managements. But the important thing we have to write that during hospitalization something happened like a complication, that is a pressure ulcer, however which is managing well. Still there is pressure ulcer and we are managing with a daily dressing, pressure relief mattress and a cushion. In addition, he was treated with various antibiotics, antacids and vitamin supplements. As I told you before, no need to write every medications because it's nothing relevant much in this case, not so. Just we can sum up like antibiotics, antacids and vitamin supplements. So, Mr. Phillips underwent surgery on 10 January 2018 and was managed in the intensive care unit. Thereafter, he was shifted to the thoracic ward. Then, he was commenced on oxygen therapy and treated conservatively. During hospitalization, he has developed a pressure ulcer, however, which is managing well with daily dressing, pressure relief mattress, and a cushion. In addition, he was treated with various antibiotics, antacids, and vitamin supplement. This is the first part of present medical history paragraph. Then in the second paragraph, we can write gradually what all the things has happened. Mr. Phillips was gradually moved to the rehabilitation ward, and presently he is maintaining 94 percentage of oxygen in room air, mobilizing without assistive aids with the supervision, and being self-sufficient in hygiene and daily living activities. However, he requires an ongoing support until his complete recovery. So in the last section, we can write that gradually he was in rehabilitation ward, and currently, that means today at presently, patient, what is the patient's condition? That is important before concluding. This is actually, it's like a concluding sentences. Presently, upon discharge, what is the condition or what is the status of patient? This is must we have to write it in our letter, because as a reader, if you are reading for somebody's letter without knowing the question paper, once if you read when you will come to this conclusion paragraph, it should be clear what is the thing they are expecting from you. So what is the requirement, exactly what is the requirement the writer is it is like expecting from the receiver side. So here it is clear that currently he is maintaining 94 percentage of oxygen in room air, mobilizing without assistive aids, and he can do the self-care activities without assistance. However, he requires an ongoing support until his complete recovery. So this is clear that still patient not yet completely recovered. So until the recovery, we have to give some assistive support for the patient. So that is nothing but just we are writing the current status of the patient and just a small topic indicating that still something is pending for the patient. So please provide this care to the patient. So once again I will read for you. Mr. Phillips was gradually moved to the rehabilitation ward, and presently he is maintaining 94 percentage of oxygen in room air, mobilizing without assisted aids with supervision, and being self-sufficient in hygiene and daily living activities. However, he requires an ongoing support until his complete recovery. Next, we will see the social history paragraph. In this letter, social history paragraph, it is very small. Nothing but Mr. Phillips is a divorcee, it's given already, and lives alone. And he is getting support only from his younger sister who lives in the same area. And regarding the medical, we can tell that he had interstitial lung disease since 2011, and now he has undergone the surgery. So until then, there was interstitial lung disease from 2011. So nothing but Mr. Phillips is a divorcee, and here if it is male or female, if it is divorced person, we can write divorcee. In case of widow, female widow and male is widower. So please keep it in mind that word divorcee and lives alone. He gets support only from his younger sister who lives in the same area. He had interstitial lung disease since 2011. Last is another recommendation paragraph. Here actually we have only 2 points to write. We can write kindly provide follow-up care with wound dressing every second day for Mr. Phillips' pressure ulcer in the coccyx. Please monitor his medication compliance since he will self-medicate all prescribed medications. So just we need the help for wound dressing in the coccyx area. So we can just write like it. Please provide or kindly provide follow-up care with the wound dressing every second day, because it's already written, it is instructed from the by the wound nurse. Then the next one, just to monitor his medication compliance, he will take selfly, but the community nurse have to monitor his medication compliance. That's also kindly provide follow-up care with wound dressing every second day for Mr. Phillips' pressure ulcer in the coccyx. Please monitor his medication compliance since he will self-medicate all prescribed medications. That's all the recommendation paragraph. And the conclusion, same like other letters. If you have any queries, please do contact me. Yours sincerely, registered nurse. The reader name is given, so we can write sincerely. If it is not given, you have to write faithfully. So I hope this letter is clear for you. Please don't get confusion while you are writing the present medical paragraph. What is the thing it's given? You have to give equal importance. In some letters, the condition will be reason present medical condition will be only one. Sometimes it is associated disease conditions, like example diabetes mellitus and legals. It is like associated, or else we can tell that it is secondary because of one disease condition, the other one's happened. Here we could not tell that it is not related, but because of surgery, patient got admitted, and during hospitalization, he has developed another one disease condition. That's why we have written in the introduction paragraph, he is recovering from the surgery and he has this condition. So both are important. And in some cases, you will get only one condition, and in the present medical paragraph should be the expansion of that. Whenever you will have two or three reason present medical condition, you have to expand everything in your present medical paragraph. You can split it into two paragraph, not more than that. Then you can sum up it all. Each paragraph should be the relevant data. And please try to write only relevant data. Please don't write irrelevant data. You have to find out which is relevant, which is irrelevant, and semi-relevance can be written or can be ignored, no problem. So please keep it in your mind. Always try to write only relevant data in your letter, and don't write any irrelevant data. So both it will affect your marks. So we will see with another one interesting OET letter. Until then, take care. Bye.